Assalamualaikum warahmatullahi wabarakatuh. Hi everyone. Today I will do a socialization about how to improve the life quality of stroke patient with paralysis. My name is Aisyah Nurlailia. How are you today? Hopefully you are fine. Okay then, let me start the socialization. Do you know what is stroke? Stroke is interference of the brain function because there is blockage or the rupture of blood vessel in the brain, with the symptoms and signs happen for 24 hours or more. Besides, I will inform you about the causes of stroke. There are hypertension, high cholesterol, heart disease, overweight and diabetes mellitus, smoking, emotional stress, illegal drugs, alcohol drinker, and lack of exercise. Alright, let's move to the signs and symptoms of stroke. There are actually many signs and symptoms of stroke. 5 of them are suffering infirmity and paralysis, speaking defect, speaking disorder, anxiety and aphasia, or we commonly know as communication interference. After that, I am going to explain few therapies for the stroke patients that can be done at home. The first, range of motion therapy. Do you know what is range of motion therapy? Range of motion therapy is a therapy that is used to train the joint movements. Lying the patient down on the comfort position. Shoulder flexion and extension. Repeat the same movement for both hands. Internal and external shoulder rotation. Turn the arms so it can face up. After that, turn the arms back so it can face down by rotating the shoulder joint. Repeat the same movement for both hands. Elbow flexion and extension. Fold the patient elbow until the hands touch the shoulder, then straighten both arms. Do the same movements to the hands. Fingers and both wrists flexion and extension. Bend the wrists away from the body perpendicular while strengthening the fingers. Bend the wrists to the opposite direction while clenching the fingers. Pelvis flexion. Lift the knee and bend towards the chest. Then send the legs to the previous position. Repeat the same movement to another leg. Pelvis abduction. Move the leg in line the bed, avoiding the body so that the leg makes 45 degrees corner. Repeat the movements to another leg. Knee flexion and extension. Lift the leg and fold it in exact pelvis joint so its shape is 90 degree and push the ankle until the heel touches back. Repeat the same movements to another leg. External and internal knee rotation. Fold the knee until creating 90 degrees corner. Rotate the leg outward and inward, repeating the same movement to another leg. Practice this therapy twice in a day within 6 days. Practice it about 15 to 20 minutes for every session. If the patient can't bed rest totally, change the position every 2 hours to the right and to the left. Then I will train A, I, U, E, O, A, I, U, E, O therapy. This therapy is done so that the patient are able to communicate well. Grandma, please follow me. A, I, U, E, O. Apple. In. Umbrella. 11. X. On. Off. Please do this practice at least once in a day regularly until the patient shows significant progress after therapy process. Besides various home-based therapies, stroke patients also need family support during the recovery process. There are some family support that we can do. 1. Giving attention. 2. Keeping silent when the patient gets mad. 3. Reminding the patient always being calm and patient. 4. Fulfilling the daily needs such as food, drink, and etc. 5. Fulfilling the physical needs. 6. Providing the patient's health information. 7. Providing other medical treatment information to support the recovery. 8. Giving motivation. 9. Giving appreciation because the patient obediently to therapy and other medical treatments. So these are some ways that we can do at home which contribute to speed up the recovery process of stroke patient. Hopefully what I have explained is beneficial for many people. Let's practice this therapy to help our beloved ones recover with therapy, healthy ever after. Thank you everyone. Wassalamualaikum warahmatullahi wabarakatuh.